Detecting colorectal cancer may soon get easier. The FDA has approved this new blood test. It's designed to help detect the disease a lot earlier. The American Cancer Society estimates there will be nearly 160,000 new cases this year and more than 55,000 deaths, making early detection so very important. Joining us now is Dr. Trisha Pasricha. She is a gastroenterologist at Beth Israel at the Medical Center, and she's an assistant professor at Harvard Medical School, too. Great to see you. Thank you for coming on. This is amazing news. So it's a blood test that can determine if you have colon cancer?
Yeah, that's right. So this is a new blood test. It was just approved by the FDA. And so what it does is it detects certain patterns of fragments of DNA in your bloodstream that may have been shed by the tumor. So it's one of 2 blood tests that have been approved. And it's a really easy way. You could just walk into your doctor's office, get screened for colon cancer if you're 45 or older, and walk out.
That's amazing. A lot of people don't want to have a colonoscopy, right? What age should you start having a colonoscopy or this blood test?
Yeah, so remember, we lowered the age. It used to be 50. Now
Right.
it's 45. So everyone aged 45 and older is eligible for screening. This is a really nice test for people who are otherwise not going to get any tests. You know, only about 2/3 of Americans are actually up to date with their colon cancer screening. So this is a big gap we need to fill. But there is an important nuance that I'd like to remind people of. This test, these blood tests, they're not equivalent to the colonoscopy.
Okay.
They don't actually perform as well. They detect about 80% of cancers. Colonoscopies, they detect upward of 95%. So if you're able to do the colonoscopy, that is always the best choice. But if you're somebody who just can't make it to the colonoscopy screening for any number of reasons, this or the stool kit could be a really nice way to get screened.
Okay, we do see those commercials on TV. So when it comes to colon cancer, 45% of patients with colon cancer are under the age of 65. Why are we seeing more young people get colon cancer?
Yeah, this is a really concerning trend. We've been seeing these cases rise among younger people since about the 1980s, 1990s. Scientists have really honed in on the idea that it is something in our environment, and specifically a large part of that is our food, right? And so I think in the last 5 to 10 years, we've seen more and more studies on ultra-processed foods, for example. And not just ultra-processed foods that we're eating as adults, but really the kinds of foods that we eat in our childhood, in our teenage years. These are the ones that seem to play a big role in who's going to get colorectal cancer once we turn late 20s, 30s.
There are a lot of people that just think it's embarrassing to get a colonoscopy. They're not excited about the prep, which is very easy. It's not like our grandfather's prep, as we were talking about in the commercial. But it is much easier. But a lot of people are scared. Is that what you're hearing from your patients? The blood test could be an alternative if you're one of those people that you really don't want to go get a colonoscopy.
Yeah, I mean, there's a couple things. Like, one, yeah, a lot of people just don't get the colonoscopy. They are worried about how difficult the prep's going to be. I always like to reassure people the prep is going to be straightforward, right? And you don't have to drink those 4 liters of liquid that people were drinking before. There are lots of other options. But remember that this new test, it detects colon cancer. Colonoscopies do something very different. They prevent cancers. And so if you reframe it that way, and you can otherwise get the colonoscopy, yeah, it's more inconvenient. But what you're doing is stopping yourself from ever getting colon cancer. With these blood tests, which are wonderful, any test is better than no test. You're just detecting it once it's already there.
And if you have it in your family, sometimes they'll actually give you the test, and insurance will cover it before the age of 45.
That's right. So if you have a family member, say your father had it at the age of 47, you should start getting screened much early, like 30. And insurance will cover that.
Okay, thank you so much. It's
My
important.
pleasure.
What a great topic. Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.